All right, well, I really appreciate you guys being here early. Thank you so much. Welcome to day 2. We got another packed day of some phenomenal speakers. But I wanted to kick it off with a special presentation from one of our partners, the Our Baby Foundation. It's an amazing organization. It's dedicated to making sure every emergency room is prepared to give babies a life-saving support if necessary, to save as many babies' lives as possible. I'm going to show the video, and then I'm going to bring out the founder of Our Baby, the Chief Operating Officer of Marathon Asset Management, Andrew Rabinowitz. But let's roll the tape, show this video. Thank you.
Losing a child stays with you. A piece of you is gone forever.
Children are our most vulnerable population. They have specialized problems, and they don't just have the same problems adults do scaled down to a small child. Rather, they have things that are unique, that need not only specialized equipment, but more importantly, specialized and sophisticated care by physicians, nurses, and other caregivers. About 1 in 5 children every year seeks the care of emergency services. 90% of the hospitals in the country are general hospitals and not specialized in pediatric care. So the consequence is that while there are a lot of children in need of care, they're often going to a facility that may not be properly primed for their needs.
8 years later, after Rebecca died, not a day goes by that I don't think about her. And that's why Our Baby was founded, to make sure that every single baby and child gets the best available health care.
And we started out with simulation training for doctors, to re-educate them, to have them learn the proper techniques.
Our goal is to make sure that any baby in an emergency situation gets the appropriate care.
What we focus on is working with doctors and with physicians to understand how we can improve medical health care for children.
The solution is to begin to set up a network of collaboration whereby physicians and other healthcare providers in children's hospital help interact, engage, educate, and collaborate with people in other facilities so that we constantly have the dialogue that helps raise everybody's expertise, and that we help bolster the services in a general hospital so that they rise towards the same level of sophistication that one might find in a pediatric hospital. This is what I think Our Baby's magic will be, and that is to create a network that allows individuals to have a conversation with the opportunity of raising expertise through conversation, through sharing of experience, and potentially moving patients under circumstances when the physical resources or the human resources are not appropriate at a particular site.
Foundations such as the Our Baby Foundation are exactly what we need to educate the people who are seeing the children in emergency departments now.
Ladies and gentlemen, please welcome Andrew Rabinowitz.
Thank you. I really want to thank Anthony Scaramucci, who's not only a friend, but someone who's been very supportive of the foundation over the last 10 years. In the 2 minutes, I just want to give you a brief summary of what we do and just highlight some things that were in the video. First is over 80% of children cared for in ER rooms, not babies, but children, are not seen by pediatricians, over 80%. And only 6% of ER rooms have the necessary supplies for pediatric emergencies. Even the drug companies, when they come up with drugs, don't test on children for dosage. And as relates to babies, we have 3 times the infant mortality rate that Japan does. My daughter should be here, absent a mistake by some doctors. So where does the money go to? First is training. Trained doctors. We've come up with the first program that's in over 500 hospitals where they practice for 30 days on mannequins, live mannequins, to learn how to make mistakes on dummies or mannequins rather than babies. According to Yale, which was our first hospital that we work with, and they tracked the results over the last 5 years, mistakes have been cut down by over 40%. So mistakes that, things that can lead to death or disability have been avoided. Physician resources, parent education. We actually did a video with the help of Pix 11 on educating parents what they need to know. That actually ended up winning an Emmy. And a lot of money also goes into research. We've tracked this over the last 10 years. There's been over 1 million children that have been benefited from our programs. We work with over 500 hospitals. We've held 75 conferences. Nothing as grand as SALT, but we get 1,000 of the leading physicians across the U.S. to come in to talk about best practices. We've been in 48 publications. How can you help? Well, one is obviously donate, and our website is www.ourbabyfoundation.org. The money can actually be directed to a local hospital. We've had people who've, in Westchester or Chicago or Cleveland, where we just work with their specific hospital for events. We've done things like the Tough Mudder or walks and runs. We do a tennis event every year that's supported very nicely by people like Bill Ackman and Mark Lazary, Bruce Richards, Einhorn, and Sternlick. And of course, lately we've been doing a lot of bar mitzvah projects, which is a nice way for the kids to do something. And we just did one where we raised money for toys for kids with cancer that the bar mitzvah kid was able to drop off the toys for the kids with cancer, and it was a nice way to bring joy to their life. So I wanted to say thank you for listening, I appreciate SALT and Anthony Scaramucci for all their support and your support. Thank you.